There we go. Good morning, everybody. My name is Christy. I am the Marketing and Communication Specialist here at Easter Seals. Lorraine is not here this week. She is on vacation. So we are going to provide you something a little bit different regarding the COVID-19 vaccine. So I have here with me Dr. Michael Rakoski. He is a great part of Easter Seals. He is our advisor, our medical advisor. He has also been a pediatrician for 40 years and has been in private practice for 36 years and retired about 3.5 years ago. We are so grateful to have him here today with us, and we are looking forward to learning a little bit more about the vaccine. So Dr. Rakoski has been working in Waterbury as an advisor as well on the COVID-19 vaccine. If you recall, last week I had asked if you would all send me some questions that you would have in order for us to give you more information about the vaccine, how it protects against the virus and other things like that. And you guys really did a great job and sent me a bunch of questions that we are going to ask the doctor today. So welcome, doctor. Thank you for being with us.
Oh, it's a pleasure to be here.
We're looking forward to hearing all of your information in hopes that we can, provide more information to our staff and to learn a little bit more about the vaccine and the safety and learn about some of the other questions that people have regarding the vaccine. So that being said, here we go. So the first question I was sent is, how effective is the vaccine?
Vaccine's very effective. It's one of the most effective type of vaccines, especially the messenger RNA. There's 3 vaccines that are approved by the Food and Drug Administration in the United States. There's a Pfizer vaccine and a Moderna vaccine, which we would call messenger RNA vaccines. And there's the Johnson & Johnson vaccine that's also approved that is called a vector vaccine. They're a little bit different in the fact that messenger RNAs are ones that most people will get now. They have a piece of RNA in them that is put into the cells. And there's a short video that I hope you guys get to watch. And the other one is a vector vaccine, which is the messenger RNA is put into a virus that can't replicate. And that is given in the vaccine. And that's how you get the vaccine that way, or the messenger RNA that way.
So we did have a question, just to move forward a little bit, about the RNA. There seems to be a little bit of a confusion between RNA or mRNA and DNA. So can you kind of explain a little bit about that, and is one different than the other?
Well, humans have a DNA. The particular virus that we're talking about is an RNA virus. So it uses RNA as its mainstay of developing and reproducing. But in humans, we have a cell that has a nucleus that has DNA in it. And it also has a cytoplasm that has a lot of proteins and other things. And one of those things is messenger RNA. And that messenger RNA floats around in there and makes proteins, basically. So what the vaccine really does is especially the messenger RNA ones, it's easy because it just gives you a messenger RNA wrapped in a bubble of a lipid called the PEG, or polyethylene glycol. So that's what we're given when we give the messenger RNA vaccine. It gets into your body and it lands on the cells, and the PEG helps the messenger RNA get into the cells where it works. Messenger RNA works and makes protein. And the protein it makes is a spike protein. That spike protein then goes to the outer surfaces of the cell. Our body recognizes this as foreign, it in turn makes antibodies to it. And as far as that goes, if the coronavirus or SARS-CoV-2 gets into your body, these antibodies that have been recognizing this spike protein is on the virus. It goes to that and destroys it.
So is that why when we do get the vaccine that some people have side effects because of this protein?
Yeah, well, the side effects that people are getting are an immune response. In other words, your body's putting out a response to this, well, in this case, the spike protein, as far as that goes. So the spike protein's on the COVID-19. The antibody comes and gets to it, and it causes an inflammatory response. That's why when you get a shot in your arm, you can sometimes get swelling and redness and tenderness. And that's probably the number one side effect that you will get when you get the vaccine. And even there, I mean, I know when I got my vaccine, the first time I got it, I didn't get anything actually. And I was worried that I didn't get any because I didn't get any reaction. But the second time I did get a little bit of reaction to the thing. And that's what happens. And everybody's different. And you can't really predict how it's going to act. Some people have more of a reaction than others, and some people have none. And I guess I was lucky because I had none the first time. And the second time lasted a day, and that was it. So I'm pretty
You are
lucky.
you are very
Yeah.
lucky. I've heard a lot of people. So reactions are normal is basically, I think, what you're trying to say here. And everybody is going to have a different reaction or no reaction. It kind of does it depend on your genetic makeup, or like it just depends on how your body reacts to vaccines?
It depends how your body reacts that day to it.
Okay.
As far as that goes. And if you have a reaction, it usually happens within 8 to 12 hours. If it, as far as the length, the time that the reaction occurs is usually no more than 24 to 48 hours. By the 48 hours up, you're probably feeling much, much better if you do have one of the reactions.
Yeah.
Reactions, other things are fever and headache, and some people get to really be tired, a little bit muscle pain, not just where you had the vaccine, but other places, chills, and probably even a little upset stomach. And the reason is probably that immune response is going everywhere, and it's giving you protection everywhere as far as that goes.
So that being said, talking about the proteins and the antibodies, if someone had COVID-19 and they already have an immune response, is the research that we've been seeing, why should they get the vaccine?
Well, it depends on how long this immune response works. It's been found that the natural infection to the virus will wane maybe after 90 days, actually even up to maybe 180 days. You still have some pretty good protection to it, but it goes down. And it when I say wanes, it means it doesn't work, or it really decreases over time. The vaccine seems to last longer, to tell you the truth. And as far as that goes, it protects you more against variants. So when your body goes against a specific COVID-2, it really acts against what it's seeing. And if there's a change to it, it may not work as well when there's a variant. The vaccine seems to work much better against the variants, and probably takes care of all of the variants better than others, but it does seem to work against most every variant out there right now.
So if and I don't know that we've spoken about this previously, but if there are other variants, do you think that there is a chance that we are going to have to get a booster shot? Like, those of us who have gotten a vaccine, do you think in the future, maybe a year from now, maybe 6 months from now, we will have to get another vaccine?
Well, it depends on how long the immunity is going to last.
Right.
As far as right now, I think immunity is lasting pretty long with the vaccine. But in the meantime, you think about, people compare it to the flu vaccine. And with the flu vaccine, you have a shot every year. And why is that? It's because viruses can shift and drift. Drift means it changes a little bit. And so that they always talk about the UK variant, and that changed a little bit, made it maybe a little bit more infective. So you pass it on to other people, but it didn't change the spike protein all that much. And because of that, the vaccine worked really well against that. In fact, it works just as well against that variant as opposed to other variants like the South African variant. The South African variant has changes in different places on the virus, and they're not just the place that the spike, the what they call antibody, has a tendency to go to. And so as far as that goes, that's why I say that it doesn't work well, but there's still spike protein on that even in the South African, so it gets rid of it pretty good.
Yeah.
As far as that goes. But there's other things on there that have drifted. And the difference between not drift, I mean, excuse me, shifted. As far as that goes, the drift is a little bit of change. A shift is more. Some people might remember the H1N1 type of flu. We all had to go out and get a different flu vaccine. And that was that year, there was a big shift, and it really changed the virus's immune response to it, as far as that goes. And so that things like that, if it lasts long enough, and that's why we want everybody to get vaccinated so we can get rid of this thing.
Herd immunity.
Yes, it will be less likely to give variants, and it will less likely to shift, as far as that goes. We might see some drift, and that may be why we will need to go ahead and make sure that we get another vaccine next year.
Yeah. So, oh, go ahead, sorry.
Go ahead.
Okay, so I know that there are a lot of folks around Easter seals who are concerned about, the reaction, as if I could go back a little bit, and getting an allergic reaction and the side effects. And is there, any way to kind of minimize those side effects? And are there different side effects between Moderna, between Pfizer, and the Johnson & Johnson vaccine? And if someone is prone to allergies to vaccines, like, is there one that you would recommend over another, now that we kind of have a choice of which one we want to get?
I think that if you're allergic, having allergic problems, the messenger RNA vaccines would be probably the better choice.
And that's Pfizer and Moderna?
Yep.
Okay.
The only reason you have a major allergic reaction is because there's a protein in there that your body recognizes and acts against. The only thing that your body can act against is the polyethylene glycol, or PEG, that the mRNA is in. And that is a bigger protein. And as far as that goes, it's a bigger molecule, and it can be recognized, and you can have the severe reactions to it. But, polyethylene glycol is in regular laxatives. If you've ever had a colonoscopy,
Right.
and they've cleaned you out pretty good with it. But that's really where the viruses, the mRNA is in. It's in that polyethylene bubble. And as far as that goes, the other vaccine, the J&J and the AstraZeneca, is a vaccine that we call a vector vaccine. It's put in a non-replicating adenovirus. So it's put into a virus, and it makes the messenger RNA, which then makes the spike protein.
Right.
And as far as that goes, you can probably have more of an allergic response to those vaccines. We don't have the AstraZeneca in this country, but everywhere else they do. It's probably the vaccine it's most prevalent worldwide. So as far as that goes, but we do have J&J, and the FDA has proved it. The one problem with J&J and reactions is that it's found that as far as that goes, that it can, rare occurrences, cause something called TTS, which is thrombosis and thrombocytopenia. Thrombosis means you get a blood clot, and you get it in little different types. Maybe people think I get a blood clot in my leg or someplace like that, and it goes to my lungs and all that. Clots that you get with the vaccine are in major cerebral vessels in your brain, or maybe in right around in your gut, as far as.
Perfect.
So your gut gets them, but the brain gets them too. And it can be really serious. And it's really unusual too, because it also has to have the thrombocytopenia, which means that your platelets go down.
Mm-hmm.
And instead of, you'd think platelets might go up to give you a clotting type of thing, but it's the decrease in platelets and a blood clot, basically it's in your brain, are the two things that happen in this rare incidents where the J&J, they stopped it for a week or two just to make sure that they knew what was happening here.
Right. And I give them a lot of credit. I think there was only 6 reported cases of, I think it was women with blood clots. So
there's a little bit more reported now.
Okay.
But there's still only been 3 deaths. As far as that goes, and as far as that goes, that hasn't changed because people have learned how to treat it a little bit better. It's really very, very rare, and it really never happens. So as far as that goes, that's that side effects. Now, everybody also worries about allergic reactions, and I already did a little bit about the PEG part. Nobody has, and this is really one of the things you could think about. So we got 3 that are having a reaction, or there was a death with in the Johnson & Johnson. But if you look at the messenger RNA, out of all the millions of doses that they've given, there's none that can be attributed to the messenger RNA vaccines causing death.
How about if any of the vaccines causing COVID-19? Do any of them cause COVID-19?
There's a messenger RNA, it's RNA, and it makes protein, and that's all it does. It doesn't get into the nucleus of the cell where the DNA is. It doesn't do any of that type of thing.
That's great. That's great news. Because some of the reactions are, I've heard, as in the world really, that some of these reactions are very similar to actually having COVID-19. But COVID-19 is much more of a longer term of those reactions. So like a 2-week, 10 days, things like that.
COVID-19 is really why everybody's all excited about it. COVID-19 causes inflammation, and it causes inflammation everywhere.
Mm-hmm.
As far as that goes, it can cause inflammation in your brain. You can't smell, you can't taste, cause inflammation in your heart. You can cause inflammation in your lungs, problems breathing. You need a ventilator for all these types of things. It can cause problems with inflammation in your belly, nausea, vomiting, diarrhea, muscle aches, muscle pains, numbness, tingling, chills. and it can go on and on and on, and you can have what they would call a long time with it, or you could get rid of it in a week. But as far as that goes, the thing is, and what people worry about is what's going to be like in 10 years, 20 years, or 30
Right.
years. They all say that about the vaccine. Vaccine's pretty simple to figure out. The virus itself, with all the inflammation in the places it causes, what's going to happen 20, 30 years down the road.
Right.
So as far as that goes, the reason to get the vaccine is to get rid of that fear that we might have. And that's a maybe, and because nobody knows what could happen. But the vaccine is pretty safe, and it's just like any other type of thing. It's going to work, and it works well. And I don't think I'd have any fears about anything happening down the road. I would about the virus, because that's really something that we don't know about.
Yeah.
That inflammation, what's that going to cause?
Right. I mean, I know quite a few people who have had the virus. A very good friend of mine, she still cannot taste or smell. And she had the virus in November. So,
Has she got the vaccine?
She had the vaccine. Yes, she did. Yes, she did. She still can't taste or smell, but it's slowly coming back. She said she can start to taste citrus now. So it's promising.
Good.
I think
it's
all the swelling
inflammation is going away. And
absolutely.
Some people get the vaccine, and sometimes it gets rid of a lot of the side effects too.
Yeah.
Percent of the people that get the vaccine after having COVID and still have symptoms, the symptoms seem to go down there too.
Yeah.
So that may be another thing that you might say that, is a good thing to what do you call it, have the vaccine for, even if you had the COVID.
Yeah. Yeah. So,
yep.
Talking about future, there is a lot of questions about, what does happen in the future. And, there are a lot of women out there who are planning to become pregnant within the next 5 to 10 years, might be breastfeeding or, considering becoming pregnant. So what would you say to someone who is getting ready to start a family about receiving the vaccine? And on top of that, should a pregnant woman receive a vaccine?
Getting the vaccine when you're pregnant or lactating or having breast milk, as far as that goes, should be something you should discuss with your doctor.
Okay.
But looking at the studies that are coming out really recently, because the problem is we don't know because we haven't studied it. And the studies are coming out now. It shows that as far as that goes, that it seems as though that there's no problems with first of all, there's no problems with fertility as far as that goes. It doesn't show that there's any kind of problems whatsoever. The second thing is, as far as with pregnancy, you are making antibodies and they will probably go to the fetus, but they can become protective there. So as far as that goes, so you're giving protection to the baby before it's born. Yes, antibodies will get into your breast milk, but that's a good thing. So as far as that goes, so everything as far as what we can tell so far, and the studies are coming out right now, like over the last month, that this seems to be an okay thing to do if as far as pregnancy and as far as fertility goes.
Great. So I have a couple of very specific questions.
Okay.
And I'm going to ask you because they did come from the staff, so I want to make sure we get to these. So first one is, how safe is the vaccine for someone who has had a splendectomy?
Well, splenectomies are going to give you, make your immune response less vigorous as far as that goes. But it would still probably, and even other things like cancer chemotherapy or steroids, even if you're taking steroids, that's going to decrease your immune response. But for all those people, it's still recommended that you do get the vaccine because you will get some protection as far as that goes. You might not get as much of a response as others, but if you didn't have a immune deficiency going on, but it really does work
Great.
still.
So how safe is the vaccine for someone with Hashimoto's disease?
Hashimoto's disease is an autoimmune disease that attacks your thyroid. And as far as that goes, you can have the vaccine and your immune response should be fine because it's not the same as an immune deficiency as far as that goes, as like with the splenectomies or steroids or chemotherapy or something like that.
So, just to clarify, for our staff who is watching this video, I think that, we've definitely answered that question. It is safe. But if there are concerns, I think that, Doctor, you would agree with me that they should probably talk to their physician as well, just to make sure that, maybe there's other things going on in their bodies, just to be safe, make sure that your medical history is up to date, and do speak to your physician too. But this was a very helpful answer, I think. Next question is, are there any specific reports of increased side effects caused by the vaccine in an African American 60 to 65 years of age who might be asthmatic and diabetic? So it seems like there's a lot of things going on there, and just wanted to clarify.
Well, are you talking about vaccine or are you talking about the disease in this one?
Well,
Because
I think it might be both. Why don't we
the
touch on
vaccine hasn't been shown to really have any problems with 65, but the disease itself, older people have problems with it. As far as race goes, the vaccine hasn't been shown to have any problems with it, but the disease has shown to have more problems in certain races. And as far as what was the other one?
it was asthmatic and diabetic.
Diabetic, you're gonna have no problems with the vaccine. You're gonna have problems with the disease.
Okay.
The funny one, you hear about all the lung disease. If you said COPD instead of asthma, I would say yes. There's not a problem with the vaccine, but a problem with the disease. Asthma, you can probably say that it doesn't have that many problems. It doesn't have any problems at all with the vaccine, but it also doesn't seem to be one of the major problems with COVID too. Yeah, you might wheeze and stuff like that, but it's not as major as COPD or any other kind of lung disease that you might have.
Very helpful. So we're gonna wrap up in a little bit. I just have a couple more quick questions for you.
Sure.
So I know a lot of people who have had the vaccine. I know a lot of people who work in the medical field. People who have said that they, prior to their vaccine, they drank a lot of water, took some ibuprofen to kind of minimize some of those effects. Is there anything that people can do other than, taking some anti-inflammatories or hydrating to minimize some of those side effects from the vaccine?
Well, most of those things are really directed towards that redness, swelling, and tenderness. And as far as that goes, yes, you should make sure you're really rehydrated or hydrated. And as far as that goes, Tylenol or Motrin is okay. I would do that, after you got vaccinated.
Mm-hmm.
Cold washcloth can help. Massaging or just moving your arm around as far as that goes after you get the vaccine to make sure that everything is circulating out of there and you get it to get to other parts of your body instead of just your deltoid muscle up here is
Right.
what you want to do.
I mean, I was the first time when I got my first vaccine, I had gone out to dinner that evening with a whole bunch of nurses and a nurse practitioner. And I went to go reach for the salt, and I was like, they're like, keep going, keep reaching, you got to move your arms. I was like, I don't really want to be with you medical people right now. I just want to be in pain. But yeah, I mean, they were very right. And, you know, moving the area a little bit was great. And it did help me out. So I think that is definitely a good thing. I like the cold compress idea. You know, it helps with other issues that we might have. You know, ice.
Mhm.
That's part of the treatment for it. That's great. Last question is, in the unprecedented rush for a pharmaceutical company to develop the COVID vaccine, is there still work being done on making what they have come up with even better and more successful?
Um, let me quote from the 7th of May, the kinetic statistics. 667,189 people in Connecticut had gotten the vaccine. As far as that goes, only 0.02% of the vaccinated population got a COVID after the vaccine. So that's less, I mean, that's a 200th of a percent. So it's real small. Of the 294 people, 242 people that got COVID after it, 109 didn't have any symptoms. They didn't even know they had it.
Wow.
67.7% were women. 24% were in congregate settings, so nursing homes or prisons or someplace like that. 13.2% of those that got it were hospitalized. There were 3 deaths, and there was one in the 65-year-old group, one in the 75-year-old group, and one in the 85-year-old group.
Wow.
And so vaccine works well, really well.
The
And
proof is in the data,
I really
right?
do want to get vaccinated.
So I think that your recommendation is
Go
get the
for it.
vaccine. Get the vaccine. No reason
Yeah.
not to, right? Is that what
There
I'm
is no
hearing?
reason not to.
Okay.
Do it for yourself, do it for your loved ones.
That's very important. It's very important. It's important to remember that it's not it is about us, but there are people around you that we really should be thinking about too. So your community and be a part of it. So thank you so much, Doctor, for being here, and I really appreciate you taking the time to talk to all of us today. Is there anything further that you want to add before we go?
No, I think I get vaccinated.
All right. Well, thank you.
I really believe in it, and it really works.
That's wonderful. Thank you so much for being here with me. Thank you everybody for watching this video. We really appreciate you taking the time. If there are any other questions that you guys have and you did not hear me ask during the video, feel free to send them to me and I will talk to Dr. Rakoski about it and we will get you an answer as soon as possible. So thank you again, everybody. Thank you, Doctor, for joining us and we will talk to you all soon. Bye-bye.
Bye. Bye.